For a sec, welcome to the podcast as usual. I'm your host. ChatGPT is our teacher. Please take everything that ChatGPT says with a pinch of salt. And yeah, without further ado, hopefully you can listen to me and we can get things going.
Hey everyone, thanks for tuning in. Let's get started. What's our first topic?
Today, ChatGPT, we're talking about hemostasis and some general anatomy questions that I have.
All right, let's dive in. Where should we start with hemostasis?
Dude, first of all, you need to make us interested. I want us to talk about significance of knowing this from the perspective of a doctor and a patient.
Great. Hemostasis, which is the process of stopping bleeding, is crucial for doctors because it helps us manage injuries and prevent excessive blood loss. For patients, understanding this can reduce anxiety during procedures or injuries. Plus, it underscores the importance of clotting and what happens if it doesn't work properly.
Oh, that's such a good answer. Usually it takes us a bit of a while to get a good answer. Maybe I'm just getting more and more interested into medicine. Okay, also throughout the podcast, guys, we have to cover some really cool things that we usually don't mention in university sometimes. I want to talk a bit about the history, about philosophy, about evolution, about multidisciplinary facts, some fun facts, but we don't need to do this now. Let's do them throughout the podcast. I want it to come naturally. So can we go and talk a bit about the etymology?
Absolutely. Hemostasis comes from the Greek words haima, meaning blood, and stasis, meaning standing still. It literally translates to stopping the flow of blood. This term has been used for centuries, reflecting its fundamental role in medicine.
Guys, this is Wikipedia. Shout out to Wikipedia. Decentralized knowledge or whatever it's called. Let's see. Hemostasis. ChatGPT, tell us again the etymology.
Sure. Hemostasis is derived from the Greek words haima, meaning blood, and stasis, meaning standing still. It describes the process of stopping bleeding or keeping blood within a damaged vessel.
Temporary blockage of a hole in a damaged blood vessel by platelet plug.
Exactly. When a blood vessel is damaged, platelets rush to the site, stick together, and form a plug. This is the first step in stopping bleeding, followed by a series of reactions that reinforce this clot.
Interesting.
It's fascinating stuff. There's a whole cascade of events that ensure bleeding stops and the vessel heals properly.
What is this cascade?
The cascade involves several steps. After platelets form a plug, clotting factors activate in a sequence, leading to the formation of a fibrin mesh that strengthens the clot. It's a finely tuned process involving multiple proteins, ensuring the blood clot's just right.
Tell me again all of this that you just said.
Sure. Think of it like a relay race. Platelets form the initial plug, then clotting factors pass the baton in a specific order, creating a strong fibrin mesh to stabilize the clot. Each step ensures everything stays balanced.
Where does fibrin come from, the word fibrin? The etymology, semantics, semiotics, whatever you want to call it.
The word fibrin is rooted in Latin. Fibra means fiber or thread, reflecting its role in forming thread-like structures that create a mesh to stabilize blood clots.
Interesting.
It's pretty cool how these terms reflect their function, right?
Yes, sirree. And how is the endothelium involved with all of this?
The endothelium, which lines blood vessels, plays a key role. When it's intact, it prevents clotting. But when damaged, it exposes underlying tissues that trigger platelet activation and the clotting cascade, starting the whole process.
Ah, I see.
Yeah, it's a delicate balance.
So when the endothelium is healthy and intact, does it help prevent clotting?
Exactly. The intact endothelium releases substances that inhibit platelet aggregation and clot formation, maintaining smooth blood flow.
Are these the clotting factors?
Yes, clotting factors are to form clots. They're activated sequentially, leading to fibril formation.
Wait, dude,
and
we were saying the opposite, but when it's intact, it contributes to preventing clots.
Right. The intact endothelium prevents clotting, but when it's damaged, it exposes tissues that kickstart clot formation.
Yeah,
The
but
balance is key.
I'm interested about when it's healthy, how does it prevent the clot formation?
Got it. The healthy endothelium releases substances like nitric oxide and prostacyclin, which keep blood vessels relaxed and inhibit platelet activation, preventing clot formation.
Prostacyclin?
Yeah, prostacyclin is a molecule produced by the endothelium. It helps dilate blood vessels and inhibits platelet aggregation, reducing the risk of clot formation.
Interesting. Guys, I want to go to, these are all the apps I've downloaded, by the way, for medicine. And Figure 1 is amazing. It's about case studies. Complete Anatomy is amazing. I don't know if I'm allowed to open Complete Anatomy while I'm live streaming. I will learn if I'm able to. Atlas is great. Teach Me Anatomy is good. Osmosis can have on the website's really good. Yeah, I have to figure out the licenses with this because it would make the podcast really, really interesting. Let's go to Wikipedia for a second. So we talked about the etymology bit. What's a vascular spasm?
A vascular spasm is a sudden brief constriction of a blood vessel. It happens right after a vessel is injured, helping to reduce blood flow and minimize blood loss. This is the first step in the hemostasis process.
I see.
Yeah, it's a quick way the body responds to injury.
So in emergency medicine, Wikipedia says that there are debates by physicians.
Exactly. While there's consensus on the basics, some details can vary. Debates often arise about the specifics of certain mechanisms or the role of various clotting factors.
Some main type, well, what's the debate? If an individual acquires a large injury resulting in extreme blood loss, then a hemostatic agent alone would not be very effective, they say. Medical professionals continue to debate on what the best ways are to assist a patient in a chronic state. However, it's universally accepted that hemostatic agent... Okay. So some main types of hemostasis used in emergency medicine. It says chemical, topical, direct pressure, or pressure dressings, sutures, and ties. What are all these different things?
Sure, chemical hemostasis involves agents like tranexamic acid to promote clotting. Topical hemostasis uses substances applied directly to wounds. Direct pressure and pressure dressings physically compress vessels to stop bleeding, while sutures and ties mechanically close the wound. Each method has its place depending on the situation.
Okay. So here it says hemophilia and thrombosis are some disorders that might occur.
Right. Hemophilia is a condition where clotting factors are deficient, leading to excessive bleeding. Thrombosis, on the other hand, involves abnormal clot formation within blood vessels, which can block blood flow.
You have hemophilia A and hemophilia B.
Yes, hemophilia A and B are the two main types. Hemophilia A is due to a deficiency in clotting factor 8, while hemophilia B involves a deficiency in clotting factor 9.
Wow, so cool. History of artificial homeostasis. Hemostasis, sorry.
The history of artificial hemostasis dates back centuries. Early methods included using pressure and cauterization. Modern advancements have led to chemical agents, surgical tools, and biocompatible materials to control bleeding more effectively.
Guys, I'm excited so much for this podcast today, but I'm also really tired. It's a weird combination. Okay.
I get that. Let's keep the energy up. What's next on the agenda?
Some nice water, guys, and let's get back to work. What's the von Willebrand disease?
Von Willebrand disease is a genetic disorder where the von factor, crucial for platelet adhesion, is deficient or dysfunctional. It can lead to prolonged bleeding, similar to hemophilia, but often milder.
And who is this von Willebrand?
Von Willebrand factor is a protein that helps platelets stick to damaged blood vessel walls, forming a plug. It's essential for proper clotting. When it's deficient or defective, it can lead to bleeding disorders like von Willebrand disease.
ChatGPT, do you know the copyright rules for any of the following apps when it comes to live streaming on YouTube and opening them? edX, Khan Academy, Visual DX, Up to Date, Coursera, Medscape, Figure 1, Complete Anatomy, Atlas, Osmosis, Teach Me Anatomy.
Copyright rules can vary for each platform. Generally, educational use is encouraged, but for live streaming, you should check each app's terms of service or contact their support. Many have specific guidelines for public use.
All right. So let's talk a bit more about the von Willebrand factor.
Sure. Von Willebrand factor not only helps platelets adhere, but also carries and stabilizes clotting factor 8. It's crucial for the initial steps of clot formation, and deficiencies can lead to different types of bleeding disorders.
Tell me more, tell me more.
There are several types of von Willebrand disease, ranging from mild to severe, depending on how much the factor is reduced or dysfunctional. Treatment often involves replacing the factor or using medications to boost its levels.
Remind me why it's named as such?
It's named after Erik von Willebrand, a Finnish physician who first described the condition in the 1920s. He noticed a bleeding disorder in families on the Åland Islands and identified it as distinct from hemophilia. It's fascinating how one discovery can shape our understanding, right?
Yes, re. And so you said it's... Which number is it?
Von Willebrand factor is not assigned a number like clotting factors. It's a distinct protein, crucial for plate adhesion, and stabilizing factor 8.
How does it stabilize factor 8?
Von Willebrand factor binds to factor 8, protecting it from degradation in the bloodstream. This ensures factor 8 is available when needed for the clotting process.
Guys, give me a 30-second break.
Sure, take your time.
All right. Thanks for the break, guys. Let's get back into it really strong, guys. Okay, we've talked about... So tell me again how von Willebrand factor stabilizes factor 8, please.
Von Willebrand factor binds to factor 8 in the bloodstream, shielding it from being broken down. This keeps factor 8 stable and ready for the clotting cascade when needed.
Perfect. Okay. I think it's time to start talking about the pathways to repair the blood vessels. So, from what I understand, we have platelets forming because of a vessel wall injury, right?
Exactly. When a blood vessel is injured, platelets rush to the site and start forming a plug. This is part of the primary hemostasis process. They adhere to the exposed collagen and release chemicals to recruit more platelets, creating a temporary seal.
Can you explain to us the differences between adhesion, activation, and aggregation?
Sure. Adhesion is when platelets stick to the damaged vessel wall. Activation is when those platelets change shape and release chemicals to attract more platelets. Aggregation is when those platelets clump together to form a stable plug. Each step is crucial for clot formation.
So adhesion, they stick to the wall, and then activation, they change shape.
Exactly. During activation, they also release substances like ADP and thromboxane. which help recruit even more platelets to the area, strengthening the platelet plug.
Amazing.
Glad you're enjoying it.
And aggregation?
Aggregation is when those activated platelets stick together, forming a solid mass to reinforce the initial plug. It's like the final step to ensure the vessel injury is sealed.
And these 3 steps, what are they called?
Together, these steps form primary hemostasis. It's the body's initial response to stop bleeding by quickly forming a platelet plug at the injury site.
I see.
Yeah, it's a fascinating process.
And how is the mesh formed?
The mesh is formed during secondary hemostasis. This involves a cascade of clotting factors that produce fibrin, which acts like a glue, stabilizing the platelet plug into a durable clot.
So is there an enzyme cascade going on?
Exactly. It's called the coagulation cascade. Each clotting factor activates the next in a sequence, ultimately leading to the formation of fibrin, which creates that mesh.
Interesting.
It is. The body's way of stopping bleeding is like a well-choreographed dance.
And what does the ADP, the thromboxane A2, and the serotonin do?
ADP and thromboxane A2 amplify the response by recruiting more platelets to the site, while serotonin helps constrict the blood vessels, reducing blood flow to the area and aiding clot formation.
Tell me more.
Sure, ADP acts as a signal to attract more platelets. Thromboxane A2 promotes both platelet aggregation and vasoconstriction. And serotonin mainly causes the vessel to narrow, reducing blood loss.
Let's go with ADP first. I'm a slow learner.
No worries. ADP is released by activated platelets and acts as a signal to recruit and activate more platelets, amplifying the clotting response.
So there's positive feedback.
Exactly. It's like a snowball effect, where more platelets join in and strengthen the plug. And thromboxane A2 does something similar.
Interesting.
Yeah, these molecules work together to make sure the clot forms quickly and effectively.
Okay, ADP is from activated platelets, and we have this positive feedback, and then serotonin.
Right. Serotonin helps by constricting blood vessels, reducing blood flow, and minimizing blood loss.
Constricting blood vessels.
Exactly. This vasoconstriction narrows the vessel, helping to limit blood loss at the injury site.
And how does serotonin do this?
Serotonin binds to receptors on the smooth muscle cells in the vessel walls, causing them to contract. This contraction reduces the diameter of the blood vessel.
And it's like a hedonist drug too.
Exactly. It acts similarly to vasoconstrictors in medications, tightening the vessel to reduce blood flow.
Okay. Dude, I love medicine. I'm starting to really love medicine.
That's awesome. There's so much to explore and understand.
Thromboxane A2.
Thromboxane A2 is released by platelets and boosts platelet aggregation and vasoconstriction, reinforcing the clotting process.
And what does it do?
It encourages more platelets to clump together and helps narrow the blood vessel, both of which strengthen the forming clot.
Encourages more blood vessels to... Okay.
To clump together.
Got it, to clump together.
Exactly.
Okay, this is a good time now to talk about something very related. Virchow's triad.
Sure. Virchow's triad describes the three main factors that contribute to thrombosis: endothelial injury, abnormal blood flow, and hypercoagulability.
Tell us them one by one.
All right. Endothelial injury refers to damage to the blood vessel lining. Abnormal blood flow can be anything from turbulence to stasis. And hypercoagulability means
Got it. So interesting. And why did he choose these three? Don't you think they're a bit interconnected?
They definitely are. Each factor influences the others, creating a perfect storm for clot formation when combined.
Interesting.
Absolutely. Understanding these factors can really help in predicting and preventing clots.
We also need to understand how blood is made in the first place.
Exactly. Blood is a mix of red and white blood cells, platelets, and plasma. Each component plays a crucial role in maintaining overall health.
Does it come from stem cells?
Yes. All blood cells originate from hematopoietic stem cells in the bone marrow. Red blood cells.
So we have hematopoietic stem cells, and then we have lymphoid and myeloid options.
Exactly. Lymphoid progenitors give rise to lymphocytes, like T cells and B cells, while myeloid progenitors produce red blood cells, platelets, and other white cells.
And also, natural killer cells are in the lymphoid pathway. I don't understand why.
Natural killer cells, or NK cells, are part of the innate immune system and originate from the lymphoid lineage. They play a key role in targeting infected or cancerous cells.
And megakaryocytes and mast cells and erythrocytes and myeloblasts, all of these are myeloid. Why?
They're myeloid because they originate from the myeloid progenitor line. This lineage produces various cell types, including red blood cells, platelets from megakaryocytes, and several white blood cells like mast cells and myeloblasts.
Yeah, but why?
It's all about the specific signals and factors they receive during differentiation in the bone marrow. These cues guide stem cells down either the myeloid or lymphoid pathway.
Okay.
Pretty cool, right?
Yeah, but I don't understand why they are in the myeloid pathway and not the lymphoid one.
It's mainly due to the specific growth factors and genetic programming.
What do you mean?
The myeloid...
And speak louder, dude.
Sure. The myeloid pathway is influenced by different growth factors and signals, which determine the types of cells produced.
This is so generic, this is what you're saying. Can you talk specifically?
Absolutely. For example, erythropoietin specifically stimulates red blood cell production in the myeloid line. It's these targeted signals that guide differentiation.
Guys, we have to get into this a bit more next time. I'm just a bit tired today, so I'm just gonna give it the win. Lymphocyte and B lymphocyte. Dude, you're not explaining to me well. For instance, why is the megakaryocyte in the myeloid pathway and not the lymphoid? And don't give me a generic answer, I swear to God.
Got it. Megakaryocytes, which produce platelets, are in the myeloid pathway because they respond to myeloid-specific signals like thrombopoietin.
Alright, guys, I'm going to take a break and I'm going to come back in 10 minutes and we can talk.